nurses and pharmacists practicing in oncology settings identified a lot of potential knowledge gaps that they weren't really receiving in their routine education.
There's been so many new drug approvals in recent years, so it makes it tough sometimes to keep up on everything.
In the field of oncology, trying to keep up to date on all the new medications and all the side effects, and then working too, full-time, part-time, how do you fit in all the education to do with that? So this program, MOSST, on a Saturday was perfect.
MOSST is really about giving them the knowledge and skills and confidence to manage these urgent situations and problems that we face every day in oncology.
All of the presenters were well-known, well-renowned, world-renowned in their field, and they were all super excited about the topic.
I'm very passionate about education with my colleagues, sharing that knowledge with each other.
We have nurses and pharmacists learning together and that they can more fully understand each other's roles.
We work together routinely at our institution to put things together, so I think it was good for us to network with other groupings like this too, of nursing pharmacy partnership, and see how those partnerships are working.
Many practicing nurses and pharmacists have not had the opportunity to participate in simulation learning, so MOSST is providing that for them.
We have a bit of discussion and lecture with some tabletop exercises, and then they get to practice it in a simulation setting, and that overlapping is really going to seal that knowledge.
We just came from the sim labs. We just did a vesicant extravasation simulation.
How to correctly apply PPE was the one that I just came from.
The benefits, for me, it's the knowledge and the education to help make sure that I'm doing the correct things for my patient, keeping my patients safe.
Go, because the only thing you're gonna do at minimum is enhance your skills and your knowledge. So, and just strengthen the partnership with nursing and pharmacy, because it goes hand in hand every day, so.
Sure does.